What is the driving factor for you when it comes to helping women with breast cancer? What was kind of your big aha moment that you said, hey, this is a disease that actually I think is quite preventable, and certainly from a holistic perspective, there's a lot we can do to empower women. Talk a little bit about that.
How I got introduced to breast cancer on a very personal level is a dear friend was diagnosed. And in the moment she called me up hysterically crying, I said, don't worry, I'm going to go through every treatment with you. And that was an 18-month journey from the biopsy to the lumpectomy. And women who have been through this know what this is about: biopsy, lumpectomy, chemo, radiation, and then she ended up having to have her uterus removed because of side effects from tamoxifen. And I had studied about this as a student at the National College of Naturopathic Medicine, but it was a cursory, non-personal learning moment. And as soon as she was diagnosed, I started attending more advanced integrative oncology classes. I studied with Donnie Yans. I went up to Paul Anderson's classes. I did advanced homeopathic oncology. So I really increased and up-leveled my skill set, which I continue to do 18 years later since her diagnosis, because you're always learning. There's always more information to input. So I began to use my protocols with her, and her oncologist looked at her blood work. She was in the middle of chemo. She should have had anemia. She should have had a reduced neutrophil to lymphocyte ratio. She should have lost her hair, all of these shoulds. And she walked in, she was vibrant, we were upbeat, and the doctor looked at her blood work and said, I don't know what you're doing, but I want all of my patients to be doing that too. And that was really reaffirming that what I was doing with her was working. And that was the beginning of lots of women coming into my clinical practice with breast cancer. And I'll never forget the first time we went for chemotherapy. She was being treated at UCSF in San Francisco, a major oncology research center. And as soon as we walked in, they offered her some Gatorade, some Ensure. 2 minutes later, a popsicle, a hard candy when she was done chemotherapy, cupcake or a cookie. Now, I can't even tell you what that did to my blood pressure. I don't have blood pressure problems. Cancer loves sugar. Cancer chooses sugar over oxygen for its mitochondrial system. That's known as the Warburg effect. And there's a very big disconnect. That was lesson number one. There was a very big disconnect between medical oncology and science-based references and research in integrative care. It's not even integrative care. It's a statement of fact. So there's an enormous amount of material out there that unfortunately medical oncology isn't aware of that. And it became my mission to bring this to as many women as possible, because if you're choosing to do medical oncology, which a lot of women do, and I'm not opposed to that, sometimes you don't need to do that. A lot of times you do, but it's an individual choice. You also need to know what you can do to reduce the side effects, how to prepare for chemo, radiation, and surgery, what questions to ask the oncologist, what blood work you need to follow up. There's an enormous amount of material they just don't deal with. No disrespect to their system. They're just too busy with what they do. And so I am the other side of that.